Hi there and welcome back. I'm Gabriel Diaz and this is Dealing with Pain Patching Technique Series Part 3. There are two things that I wanted to talk to you about in this video. First, patching styles, and second, I'm going to introduce to you a new concept called the double path technique. Let's talk about patching styles first. If you've been following along the series, you may notice that both Part 1 and Part 2 present very different approaches to patching. The 7 techniques included at Part 1 are under a large patching style group that we call freestyle patching. Freestyle patching is quick and intuitive. It's like a point and shoot kind of approach. Very useful for many cases of pain, however not really effective for all kinds of pains though, and this is really important to note. Then Part 2 of the series includes another large patching style group that we call academic patching. This may sound a bit more intimidating than freestyle if you are new to the patches, and that's simply because academic patching incorporates more information like specific acupuncture points and meridians, and it could look more challenging initially due to all the information needed, especially if you're not familiar with acupuncture or traditional Chinese medicine like I was myself before. However, once you get the mechanics of it, I can promise you it's pretty straightforward too. And lastly, there is a third patching style group that we call interrelated patching. And that's the style I personally prefer the most, a combination of both styles, which I find to be one of the biggest advantages of Lifewave among many other technologies. So I have some suggestions for you. If you find freestyle a more suitable patching style and you're not really familiar with academic patching, do not try to escape from it. On the contrary, embrace it and dig deeper to it. Now, if you are a practitioner or a therapist and academically trained either in acupuncture, acupressure or TCM, then look into incorporate more freestyle approaches to your patching, because in both cases, once you get a real grip of it, you might be surprised of the results you can get. Now let's look at the double path technique, and for that I will need to clear the screen and put myself in it. Alright, when I was 9 years old, I had an accident and I cut 2 fingers of my left hand, and unfortunately I cut the tendons of my middle finger, so up to now I can't move the tip of my middle finger because I don't have the tendons. So, of course, that was a very traumatic event for me at the time, and I couldn't realize then how much that little event will impact me later part in my life. So, in my late 30s or in the beginning of my 40s, I started to develop a lot of pain, very annoying and frustrating pain because it will change with the weather, different pain, different intensity as well. And it was a lot of numbness going up to my elbow and my shoulder. And it really affected me a lot in my work, in my sports, and I really didn't like it. It was really terrible time for me. And I came across Lifewave technology and I started to test a lot of positions. And I found this double path idea that I'm going to talk to you about right now. But I also found out that I could apply in different situations and different places. So later part in the video, I'm going to run through a few of those. So the first thing I tested is an Lifewave tan patch at the palm of my left hand. Then an Lifewave white at the opposite side following the arrow technique, if you remember the first video of the series. Those positions helped before, but at this time I thought to add another 2 positions. An Lifewave white, but at this time at the palm of my right hand. And lastly, an Lifewave tan at the dorsum of my right hand, and also following the arrow technique. It's like a double arrow technique, but inverted between left and right side. And so you can see it again here. Lifewave tan at the left palm and Lifewave white at the right palm. Then Lifewave white at the dorsum of my left hand and Lifewave tan at the dorsum of my right hand. It's like a riddle. And that's pretty much the basic concept of this simple technique. One path is interior left and right, and the other path is exterior left and right. And of course, if you look at it closely, we are also creating another 2 extra paths. Interior exterior on the left hand, interior exterior at the right hand. And we could call this technique the quadruple path, if you will, but we thought it sounds too complicated, which in actual fact, this is a very simple approach and very effective in many cases. So let's look at another approach I tested. I started again with my left hand, and at this time I selected an excellent acupuncture point for hand issues, lung number 10 or LU10 position, which it is located at the midway of the shaft of the first metacarpal bone, as you can see in this image. You can actually locate the point and palpate it and have a very good feel of it before you start patching, and that's exactly what I do with all the points that I patch. I first apply some pressure, I have a feel of it, and then I start patching, and I do recommend that. Well, right there I place an Lifewave tan patch. Then I've selected another point at the opposite side of my right hand, but at this time right at the tip of the V shape which is formed by the first and second metacarpal bone. That's actually an extra point, a very potent one that belongs to the large intestine channel. Right there I place an Icewave white patch. Lastly, to complete the double path, an Icewave white at LU10 of my right hand, and then an Icewave 10 at the extra point at the opposite side, also at my right hand. The interesting thing is that both approaches are using the same technique, and the difference is that the first approach is a freestyle and the second approach is an academic patching style. Both work well, but to me the second approach works the best. And by the way, the second approach works very well with energy enhancer patches, so not only Icewave, you can also test with energy patches too. Conclusion. Try to comprehend the mechanics of this simple technique because I'm sure you will find many applications of it. And also try to use your imagination and create variations for your own cases. Well, perhaps I could give you a head start with that and tell you a few other areas where you could use this double path technique. For wrist issues in general, you could test a double path at the wrist itself. For hands, arms issues, or even vertigo and nausea, run it at pericardium 6 combined with triple worm of 5. An excellent combination to test actually. For elbow, arm, and even shoulder issues, run it at large intestine 11 combined with heart 3. For shoulder or upper back issues, run it at the area of pain combined with the opposite side, which is the front side of the body. For overall low back pain issues, you could test the primary bladder points combined with the kidney points at the front side, or the second line of bladder points combined with the stomach point or even the spleen points at the front. Then for feet, ankle, knees, or any other area you could think of, just use the same principles. I'm sure you will find this technique useful. Very well then, this was the double path technique and I hope you enjoyed it as much as I am making it for you. If you have any question or if you'd like to leave a comment to tell us what you feel about it, you know what to do. This was Dealing with Pain Patching Technique Series Part 3 and I will be seeing you back again on Part 4, which to me is the most important part of all 4. So stay well and see you soon. Bye.
All procedures using Lifewave patches included in this video are with the intention of providing ideas and general guidelines of some of the possibilities available. PatchingProtocol.com does not make any medical claims using Lifewave patches and does not take the place of proper diagnosis and treatment by a properly licensed healthcare professional. Members and non-members are strongly advised to consult a qualified practitioner concerning specific treatments to their particular case. In other words, we're not suggesting that you should stop any health plan you are undergoing at the moment. Our intention is to equip anyone with a certain level of understanding that a new technology which it could improve or preserve anyone's health is available, and it might be worth trying it.